Hey guys, I hope you all are doing well in preparation of NEET PG, Next PG, FMGT, USMLE, etc. Today in our very second video, we will discuss mnemonics related to bleeding disorders. Right? We will discuss bit of basics and then we will then move to mnemonics part. Right? So here, first of all, what defects can cause bleeding? Blood vessel defects, right? Example, in scurvy. In scurvy, what actually happens? Blood vessel itself becomes very weak and it can rupture and it can result into bleeding. The most important thing related to bleeding due to blood vessel defects is that all bleeding profile parameters and clotting profile parameters will come out to be normal. Then again, there can be bleeding due to coagulation defects. Sometimes there may be deficiency of clotting factors and sometimes there may be clotting factor inhibitors which can lead to bleeding. Again, you have platelet defects. These platelet defects can also result in bleeding. Sometimes there is quantitative defect. By quantitative defects, I mean thrombocytopenia. But sometimes there can be platelet dysfunction. There might be problem with platelet aggregation, adhesion or even activation. So you call it platelet dysfunction or platelet function disorders. Example, Bernard-Soulier, Glanvill's thrombectomy. Here we have a picture showing gum bleed. Suppose all parameters come out to be normal. I mean normal PT, APTT, bleeding time, normal platelet count. So if all parameters come out to be normal, then you can apply your common sense. It is related to blood vessel abnormalities. Again, like collagen vascular disorders, or it might be due to scurvy. So if all clotting and bleeding profile come out to be normal, consider blood vessel defects. Here again, sticking to basics, first of all, we have platelet dysfunction, right? You call it qualitative defect. Again, you have quantitative defect where you can have thrombocytopenia due to any reason. It can result into prolonged bleeding time and bleeding. So you have ITP, you have HUS, you have TTP, hate help syndrome, etc. Right? We will discuss mnemonics related to all these complicated topics so that MCQ approach becomes very easy. Regarding qualitative platelet dysfunctions, we have Bernard-Soulier syndrome, Glanvill's thrombectomy, von Willebrand disease, etc. Right? In these cases, because there is qualitative defect, platelet count will be normal, still bleeding time will be increased. Right? You call it platelet dysfunction. Here, bleeding might also happen due to deficiency of clotting factors or due to deficiency of or due to platelet factor inhibitors. Right? Here we have DIC. Here you have von Willebrand disease, hemophilia, antiphospholipid syndrome. We will start studying mnemonics by basic thing that these platelets contain two type of granules. We have alpha granules and we have delta granules. So it is very important to memorize the contents of alpha granules and contents of dense or delta granules. Alpha granules and delta granules have some proteins and other substances which help in platelet activation and which further helps in platelet aggregation. Right? So what are the contents of alpha granules? You have platelet activation factor, you have platelet derived growth factor, you have transformation factor beta, transformation growth factor beta, I mean von Willebrand factor and platelet factor 4. You also have few of the clotting factors like fibrinogen, like factor 13, etc. So you might be seeing here that alpha granules contain what? Platelet factors and clotting factors. What they contain? Platelet factors and clotting factors. All platelet factors and clotting factors, whichever are present in granules of platelets, are contained in alpha granules. So alpha granule contains all platelet factors and clotting factors. As simple as that. Then you have delta granules. In delta granules, you have ADP, you have ATP, you have adrenaline, you have calcium, you have serotonin. So how to memorize this? We have a mnemonic for this. Alpha gathers all platelet factors and clotting factors. Alpha granules. All platelet factors. What are all platelet factors? You can have platelet activation factor, platelet derived growth factor. You have platelet factor 4, right? We will discuss platelet factor 4 in case of HIT, heparin induced thrombocytopenia. All clotting factors, by saying all clotting factors, I mean all clotting factors which are there in granules of platelets. These are contained in alpha granules like fibrinogen, factor 13, etc. So alpha gathers all platelet factors and clotting factors. These are all are proteins. So gathers, what is gathers here? Gathers is gray platelet syndrome. So if there is defect with alpha granules, it will cause gray platelet syndrome. So we have a disease, gray platelet syndrome, and by this mnemonic alpha gathers all platelet factors and clotting factors, we can memorize that platelet factor 4, platelet derived growth factor, platelet activation factor are contained in alpha granules, and the clotting factors mainly fibrinogen, right? Then we have delta granules. In delta granules, we have certain things which again help in activation of platelets. Popular among them are ADP or ATP, adrenaline, calcium or serotonin. So this is very simple. ADP, so in delta granules, you can use mathematical terms as mnemonics. Delta is equal to deletion, right? Again, the other mathematical term ADP and ATP, right? You can say this is addition. Again, adrenaline, addition. Again, calcium, right? Calculation. Then you have serotonin, right? Subtraction. Too simple to understand. By the help of mnemonic, alpha gathers all platelet factors and clotting factors. You can memorize platelet factors contained in alpha granules. Clotting factors, whichever are present in granules, are contained in alpha granules. Gathers was gray platelet syndrome. Then for dense granules or delta granules, you have mathematical terms. What are these terms? Deletion for delta granule. Earlier I said that best mnemonic is that which contains questions also. So deletion, addition, again addition, calculation, subtraction. So delta granules contain ADP or ATP, adrenaline, calcium, serotonin, right? So there are two diseases related to what? Related to dense granules or delta granules. We have two disorders, right? So if I am not being sarcastic, I must say girls are good in maths. So check her maths. Check means Chaudhary-Higashi syndrome. Chaudhary-Higashi syndrome, right? Her maths means Herman Sky Pudlak syndrome. Herman-Sky-Pudlak syndrome, right? So by the help of these two mnemonics, you guys must be able to remember all the contents of alpha granules and all the contents of delta granules. Questions related to these granules are very commonly asked in various competitive exams. Alpha gathers all platelet factors and clotting factors, and in dense granules you have deletion, addition, subtraction, calculation, and then you need to check her maths. Check Higashi syndrome and then Herman-Sky-Pudlak syndrome. Now moving on to our next mnemonic. Before next mnemonic, let's study a bit of basics. Again you have platelets, you have endothelium, right? You guys must be seeing a structure known as von Willebrand factors. This von Willebrand factor acts like glue, right? And when it acts like glue, it attaches platelet with collagen fiber of endothelium. So you must be knowing about von Willebrand factor. Additionally, von Willebrand factor also carries factor 8 along with it. This is basic thing and you guys must remember this always, right? Again, in terms of thrombosis, in terms of clot formation, first there is formation of platelet plug, primary hemostatic plug, then secondary hemostatic plug formation leads to clot. Here in primary hemostasis, where platelets are involved, you have adhesion where platelets adhere to endothelium with help of what? Von Willebrand factor. Then platelets get activated by alpha and beta granule contents. Then there is aggregation by glycoprotein 2B3A. So there will be multiple disorders related to adhesion, activation and aggregation. We will cover one by one. Right, again a basic thing. Here you have von Willebrand factor. Here you have glycoprotein 1B. Here you have glycoprotein 2B. Glycoprotein 2B3A. So in basics we have already studied von Willebrand factor acts like glue. This von Willebrand factor is actually a very versatile substance. This guy also carries factor 8 along with it. So if there happens to be von Willebrand factor deficiency, it will lead to von Willebrand disease. First of all, again this von Willebrand factor carries factor 8 and prevents her degradation. So it maintains a certain amount of factor 8 level. So if von Willebrand factor is deficient, then again factor 8 will also decrease. So in von Willebrand disease, first of all there will be defect with adhesion of platelets. So bleeding time will increase. Secondly, there will be decrease in factor 8. So what will again happen? APTT will increase, right? Because factor 8 is part of intrinsic pathway. So see the versatility of von Willebrand factor. If von Willebrand factor is missing, right, it will lead to von Willebrand disease. Secondly, it will also affect the level of factor 8. Sometimes multimers of von Willebrand factor increase in case of gene defect Adams 13. It will lead to thrombocytopenic purpura. So von Willebrand is basically glue and it is related to 3 diseases. First of all, von Willebrand disease. Second, it is related to factor 8 deficiency. And third, it is related to thrombosis, that is known as thrombotic thrombocytopenic purpura. Right, again you have glycoprotein 1B. Right, if there is defect in glycoprotein 1B, then adhesion will not occur because von Willebrand factor attaches and platelets to endothelium with help of this glycoprotein over platelets. Again you have glycoprotein 2B3A. This helps in aggregation of platelets. Sometimes this protein is missing, right? Then the disease name is Glanzmann's thrombasthenia. Sometimes antibodies are formed against this glycoprotein and it will lead to thrombocytopenia. That disease will be known as ITP. We will be covering all these diseases, mnemonics related to all these diseases, so that your MCQ approach becomes better, right? Next. First of all, we will be covering von Willebrand disease. This von Willebrand factor acts like glue. Von Willebrand, it is a brand, so it must be dominant brand. What first comes in our mind, but leave this. You have a simple mnemonic for remembering various things related to von Willebrand disease. Right, the mnemonic is dominant wrestlers of WWF. Earlier WWE was known with the name of WWF. 8 gluten-free platter and destroyed risky opponents. So how can we decode this mnemonic? Dominant wrestlers, right? It is autosomal dominant. First of all, wrestlers is equivalent to von Willebrand factor. Again you have von Willebrand factor, right? WWF, 8 gluten-free platter. 8 can be replaced with 8. So it also carries factor 8 along with it, right? Now you guys must be able to understand, if there is deficiency of von Willebrand factor, there will be again deficiency of factor 8 also, right? Because von Willebrand factor prevents degradation of factor 8 as well. Gluten-free, it acts like glue. If we talk about von Willebrand factor, gluten-free, consider it as a single word. Platter, gluten-free platter, GP. Again, A is first letter, you can replace it with 1A. Then you have destroyed. Destroyed can be replaced with desmopressin, right? And then you have risky opponent. What is risky? Ristocetin. Opponents means opposite, you can replace it with negative, right? So this mnemonic also carries the question part also, right? So dominant wrestlers of WWF ate gluten-free platter and destroyed risky opponents. By this mnemonic, you can understand that this is autosomal dominant disease, right? WWF 8, right? 8 with F, it carries factor 8 along with it. Again it acts like glue. Again glycoprotein 1A, again ristocetin negative, right? So we have clubbed two diseases. Glycoprotein 1A, if missing you call it Bernard-Soulier syndrome. Again, what is desmopressin? Desmopressin is drug given to treat von Willebrand disease along with von Willebrand factor concentrate, because desmopressin increases release of von Willebrand factor. So in case of von Willebrand disease, you need to know that this is autosomal dominant disease. Secondly, it carries factor 8 along with it. Thirdly, it acts like glue, right? If there is deficiency of factor 8, then prothrombin activated partial thromboplastin time will increase, right? If this von Willebrand factor itself is deficient, then it will not be able to glue platelets with endothelium, so bleeding time will increase. So here you can relate to increase in APTT, here you can increase in bleeding, relate to increase with bleeding time. Again factor 8, gluten-free platter, gluten-free platter, glycoprotein 1A. Glycoprotein 1A and von Willebrand disease, 1A and von Willebrand disease, right? I mean Bernard-Soulier and von Willebrand disease are related to ristocetin negative test. Ristocetin negative test, right? And what is desmopressin? This is used in treatment of von Willebrand disease. So with the help of this mnemonic of von Willebrand disease, you can memorize all things, almost all things related to von Willebrand disease, right? Be it autosomal dominant, be it how it is related to factor 8, increase in APTT, increase in bleeding time. What is the treatment? That is desmopressin, right? And other test, that is ristocetin negative. Ristocetin negative. What other disease manifests with ristocetin negative test? That is deficiency of glycoprotein 1A, that is Bernard-Soulier syndrome, right? So I hope this mnemonic is quite helpful in memorizing all related things with von Willebrand disease. We have an MCQ over here. A 7-year-old girl presents with repeated episodes of bleeding into joints. APTT is prolonged but PT is normal. So APTT is prolonged, you can take it as defect in intrinsic pathway, right? This is defective. What is the most likely diagnosis? So a girl, so it cannot be what? X-linked recessive. So it cannot be hemophilia, because hemophilia is X-linked recessive. It will manifest only in males, right? So this option is ruled out. You have again symptomatic patient, so factor 12 deficiency is ruled out. Now you are left with two options. Factor 7 deficiency will lead to prolonged PT, but PT is normal in this patient, so this option is again ruled out. So we are now left with von Willebrand disease. Von Willebrand disease. Here APTT will increase, bleeding time will increase, ristocetin test will be negative, and patient will be symptomatic. What will be the treatment? You can give desmopressin, you can also give von Willebrand factor concentrate. So I think now you guys must be clear with all the related things related to von Willebrand disease. Again, we have Bernard-Soulier syndrome and we have Glanzmann's thrombasthenia. Again, platelet function disorders. Bernard-Soulier syndrome, Glanzmann's thrombasthenia, right? So here you can see two things. One is that Bernard-Soulier. You guys must be knowing that there are big sized platelets in case of Bernard-Soulier. So this is big size. Right. Second thing, you have again RN. This RN stands for reduced number of platelets. Reduced number of platelets. So there will be associated thrombocytopenia in Bernard-Soulier syndrome. Second thing is that RN also stands for ristocetin negative. Ristocetin negative. Okay, as we have already seen in case of von Willebrand disease, right? So which glycoprotein is missing in case of Bernard-Soulier syndrome? You have negative glycoprotein 1A. This is missing. Whereas in Glanzmann's thrombocythemia, glycoprotein 2B 3A is deficient. So how you guys will remember these things? Glycoprotein 1A, Bernard-Soulier syndrome. Take alphabetically. Bernard-Soulier, B comes first. So glycoprotein 1A, right? This is related to adhesion. Again glycoprotein 2B, right? GT. Alphabetically GT comes later to B. So we can say in glycoprotein 2B deficiency, the disorder will be Glanzmann's thrombocythemia. So basically important is this part, Bernard-Soulier syndrome, right? Bernard-Soulier. Big size platelets. Big size platelets. And the second part is as RN. Reduced number of platelets. Second thing is ristocetin negative. Ristocetin negative, right? So we have learned multiple aspects of Glanzmann's thrombocythemia, Bernard-Soulier syndrome, right, and von Willebrand disease. Now moving on to next mnemonic. You have TTP, right? You guys must be knowing about the pentad of TTP. I mean thrombotic thrombocytopenic purpura. Again, it becomes very difficult to memorize all the events of TTP again. What is pentad? We will come to that part later, right? So we have mnemonic over here to memorize the events of TTP, thrombotic thrombocytopenic purpura. We have already discussed sometimes von Willebrand factor multimers increase. Multimers increase. Why they increase? Due to absence of a protease, due to a gene defect. There is defect in ADAMTS13 gene defect, right? This gene is defective. So if this gene is defective, then von Willebrand factor will multimerize and it will cause thrombosis, and that thrombosis will lead to thrombocytopenia. So what is the mnemonic? We have please follow US treatment protocol for neuro patients admitted in emergency. Please follow this part. Is related to treatment of TTP, that is plasmapheresis. Plasmapheresis or plasma exchange, right? US. What is US over here? US is Upsha-Sulman syndrome, congenital variant of TTP. Upsha-Sulman syndrome, right? Usually it is an acquired disease. Sometimes congenital variant is also there. You call it Upsha-Sulman syndrome. What is treatment protocol? Sometimes you write treatment this way. Treatment, and again you have protocol. This makes your TTP. So mnemonic also includes the question, right? Plasmapheresis, Upsha-Sulman syndrome, and then TTP. For here patient will suffer from fever also. Neuro patients, there will be neurological manifestations also. Whereas in HUS, fever and neurological manifestations will be missing. Admitted stands for ADAMS 13. It is emergency, right? TTP is emergency. You need to go for plasmapheresis. So these simple mnemonics will help you memorize all the related things, right, to TTP. So again, please follow US treatment protocol for neuro patients admitted in emergency. Please follow plasmapheresis, US Upsha-Sulman syndrome, treatment TT, then protocol TTP. So this mnemonic is related to TTP. For means fever, neuro means neurological patients. HUS is triad. So in triad you add these two things, fever and neurological manifestations, it will make TTP. Admitted means Adams 13 is missing. An emergency, you need to have plasma exchange in emergency. So this mnemonic will make lot of things very connected and easy related to TTP. Again, we have a simple multiple choice question. A person presents with fever and altered consciousness. What is fever? Again, one of the manifestations of TTP. Altered consciousness, I mean neurological manifestation is there. What are the other features? Anemia, right? Then cystocytes. Platelet count is 20,000. There is thrombocytopenia. Serum create is 3 milligram, that is raised more than 1 milligram per deciliter. Again, there is renal problem. So there is a pentad. We will come to that pentad later. So a person is suffering from fever and there is also neurological involvement, that is altered consciousness. So what you guys are seeing, that there are 5 features: altered consciousness, you have fever, you have thrombocytopenia, you have anemia, and you have altered renal function. So TTP has pentad. But the question has not asked about the diagnosis, about the treatment. What is the treatment of TTP? It is plasma exchange. This mnemonic is quite helpful in remembering all the episodes, all the things related to TTP. Please follow US treatment protocol for neuro patients admitted in emergency. Right. These are the multimers of von Willebrand factor. Right. So in absence of Adams 13, right, this protease is not getting formed and it will lead to increase in multimers of von Willebrand factor, that will result in thrombosis, and that thrombotic event will lead to thrombocytopenia. Again, what is the triad of HUS and what is the triad of TTP? HUS, you have hemolysis, it will result into anemia, uremia and thrombocytopenia. By that previous mnemonic, we had understood that fever and neurological manifestations, right, will make this triad as pentad. So you also need to know the 3 features of HUS and the 5 features of TTP. Again, the next disease, ITP. What is ITP? We have already discussed. There is glycoprotein 2B3A. Sometimes antibodies are formed against this glycoprotein and it will lead to platelet destruction and ultimately thrombocytopenia. Right, thrombocytopenia, that is platelet count will decrease and it can result into bleeding manifestation. So you can call it immune thrombocytopenia, you can call it idiopathic thrombocytopenic purpura, right? You can also call it isolated thrombocytopenia. Right, only platelet count will go down and that will happen due to presence of antibody against glycoprotein 2B. So we have again a mnemonic which will help you to memorize all the related things to ITP. This is immune thrombocytopenic purpura. What was the disease when this particular glycoprotein was missing? It was Glanzmann's thrombocythemia. Here this glycoprotein is not missing. There is antibody against it. So there will be antigen antibody reaction which will lead to destruction of platelets and thrombocytopenia. What is the mnemonic? The mnemonic is its special immigration policy to become great nation. Right? Some country might be following it. It means ITP. What is it? It is ITP. Special means treatment part is here. Splenectomy. Splenectomy will help. Right? An immigration policy means treatment will be by also immunoglobulins. Immunoglobulins. You need to give intravenous immunoglobulin IVIG. Prednisolone again can be given. Policy stands for prednisolone. To become can be written as 2B. And then great means glycoprotein. So there will be formation of antibodies against glycoprotein 2B. So now we can summarize this mnemonic. It means ITP. Question is including, sorry, mnemonic is including the question also. Special means splenectomy. Immigration means IVIG. Policy means prednisolone. To become, to be, and then great means glycoprotein. So glycoprotein 2B will be targeted by those antibodies, which will ultimately lead to destruction of platelets, right? So I think this is quite clear to you guys that it's a special immigration policy to become great nation, right? Brain drain sort of thing. Again, you have antibodies against glycoprotein 2B3A, which can mediate ITP. Now again, one more disease in which clotting factors are not deficient, but there are clotting factor inhibitors which can lead to bleeding, or which can even lead to thrombosis. It depends whether we are talking in relation to in vivo or in vitro. Antiphospholipid antibody syndrome. It can also be called as antiphospholipid syndrome. What is this? Antiphospholipid antibody syndrome or antiphospholipid syndrome. Quite simple. So these 4 letters and 3 letters carry all the required thing which can be needed for memorizing things related to antiphospholipid syndrome. See, first 2 letters. AP, it indicates increase in activated partial thromboplastin time. Again, the other 2 letters. Lupus anticoagulant, which is actually a misnomer, right? It is actually procoagulant in vivo. Again, L, lupus anticoagulant, so it is related to lupus, SLE, lupus. Quite simple to remember, right? Again, 3 antibodies are involved. 3 antibodies. Main antibody is lupus anticoagulant, right? So this mnemonic, the letters itself will tell about the various aspects of antiphospholipid syndrome. So AP stands for increase in APTT. Other parameters will be normal. Then again it is related to SLE. Again it is related to lupus anticoagulant. There will be 3 antibodies, right? So here in this 3 antibodies. What are the 3 antibodies? 3 letter 3 antibodies, right? So you have lupus anticoagulant, anti-beta-2 glycoprotein 1 antibody, then again anti-cardiolipin antibody, anti-cardiolipin antibody, right? What is P? It complicates pregnancy. It can lead to abortion, stillbirth, pregnancy related complications, right? Pregnancy related complications. What is S? You need to treat only symptomatic patients first of all. Second, it is related to snake venom, right? Now you guys must be able to relate it. It has Russell's viper venom assay, right? This increases. This is again helpful in making diagnosis of antiphospholipid syndrome, right? So by these letters you can simply remember the various manifestations aspects of antiphospholipid syndrome or antiphospholipid antibody syndrome, right? Again, APTT will be increased. There will be lupus anticoagulant. One more thing, LA again stands for treatment also, low molecular weight heparin, and A stands for aspirin, right? These 2 drugs will help in treatment part also. So antiphospholipid syndrome can be memorized with the help of these 2 mnemonics, right? And that is included in the name itself, APLA, right? APTT increased, SLE, and then you have lupus anticoagulant, 3 more antibodies, treatment part, aspirin, and low molecular weight heparin. Okay, and then Russell's viper venom assay also increases. Again, these are various manifestations of antiphospholipid syndrome. Then one more disease, hemolytic uremic syndrome, HUS. You guys must be knowing it follows bloody diarrhea due to infection of enterohemorrhagic E. coli, right? A gram negative bacteria. It is closely related to other gram-negative bacteria, Shigella, Salmonella. So whenever you interpret Vidal test, you go for O antigen and H antigen, and you simultaneously look for the titers. So O is somatic antigen, H is flagellar antigen, right? And it follows bloody diarrhea. WHO proposes multiple treatment protocols for diarrhea and anemia. So this mnemonic is US trying to follow WHO diarrhea and anemia guidelines. So if we consider anemia, right, hemoglobin 15 can be taken as normal, and hemoglobin less than 7 can be taken as severe anemia. It is approximate value, I know. US means hemolytic uremic syndrome. US. Trying means it is triad. What is the triad? There will be anemia, there will be thrombocytopenia, and there will be renal complications, right? Anemia, decrease in platelet count, and renal abnormalities. So this is triad. Trying to follow WHO diarrhea and anemia guidelines. Diarrhea, again, diarrhea will include bloody diarrhea due by enterohemorrhagic E. coli. Again, it will include the treatment part, that is hemodialysis or peritoneal dialysis, which may be needed to treat hemolytic uremic syndrome. Anemia guidelines and WHO. So you have the stain of E. coli, that is O157H7. So what is the WHO cutoff of anemia? You have 15, 7 and 7. So by this mnemonic and by relating it with Vidal test, you can say that it will include antigenic variation of two antigens, right? That is somatic antigen and flagellar antigen. So O and H, right, can be related to Vidal test. Then O 15, 7, the cutoff of anemia and normal hemoglobin, and then H7. So WHO's anemia criteria, WHO's diarrhea criteria. So this formulates the mnemonic. US trying to follow WHO diarrhea and anemia guidelines. US is HUS, trying is triad, WHO HO, and then anemia 15, 7, and then 7, 157 S7, right? This is the stain of E. coli which may cause hemolytic uremic syndrome following a bloody diarrhea event. Again, there is HIT. HIT is heparin induced thrombocytopenia. Again, it can lead to thrombosis, right? And this thrombosis can lead to thrombocytopenia. We have earlier discussed about delta granules and alpha granules. Alpha granules, we studied that it contains platelet factor 4. So sometimes following heparin, antibodies are formed against platelet factor 4, and later on it induces activation of platelets and it results into thrombosis and then thrombocytopenia. So what is the mnemonic to remember this part, right? And other events related to heparin. You have 4 puff. The mnemonic is 4 puff of hash. Hit me strongly, seriously, directly. You also know that heparin is strongest acid of body, right? So it will need an antidote in form of strongest base, that will be protamine, right? We will discuss that part later. 4 puff related to HIT, right? 4 puff means platelet factor 4. Hash means heparin. HIT means heparin induced thrombocytopenia. Strongly means it is strong acid. By strong acid, you can understand that it will need antidote in form of strong base, that is protamine sulfate. Then seriously, how will you diagnose this case? Heparin induced thrombocytopenia. You need serotonin assay, right? Directly. If heparin is not being given as patient develops thrombocytopenia, then you need direct thrombin inhibitors. inhibitors. Example are gatroban. So this mnemonic is complete in itself, right? You have 4 puff of hairs. Hit me strongly, seriously, directly. 4 puff means platelet factor 4. So antibodies will be formed against platelet factor 4. Hit me means heparin induced thrombocytopenia. H means heparin. Strongly, strongest acid, so it will be treated by protamine sulfate, the strongest base. Then seriously, seriously means serotonin assay. And then how to replace anticoagulant with other, you have directly in form of direct thrombin inhibitors, that is argatroban. So guys, in comment section do let me know what is this manifestation of HIT known as. Okay, now again mnemonic related to warfarin and heparin. Okay, so here you have a mnemonic related to politicians, internally happy and externally at war at press conference. PC stands for press conference. Internally happy, happy means heparin, right? Internally means it is related to intrinsic pathway. So heparin is treatment is monitored by problem in intrinsic pathway, so that is related to APTT, right? Heparin monitoring requires APTT monitoring. And then externally war, externally means extrinsic pathway, right? War means warfarin, right? So extrinsic pathway is affected, right, by warfarin, so PT will be prolonged, right? So it is monitored with help of PT and INR. You guys must be knowing that INR is calculated with help of prothrombin time. What is AT? AT means antidote. Antidote. Antidote of warfarin can be fresh frozen plasma, or in emergency prothrombin concentrate. Prothrombin concentrate can also be used or must be used in emergency. So this mnemonic also helps to gain some knowledge related to heparin and warfarin. You have internally happy and externally war at press conference. So this is the show off. So internally happy, intrinsic pathway affected by heparin, so monitoring is done by APTT. Externally at war, I mean extrinsic pathway is affected with help of warfarin, so PT and INR will be prolonged, so monitoring needs INR. Again, AT means antagonist or antidote, I must say, FFP or prothrombin concentrate. Right, again protein C and protein S, right, are anticoagulant. Right, so they will stop the clot formation. So these are anticoagulants, you can remember by this stop clot. Again, in the previous video we have already discussed the mnemonic related to coagulation cascade, the way to remember the things of intrinsic pathway and extrinsic pathway and even the common pathway, right? So you can refer to the previous video for the mnemonic of coagulation cascade. Again, you guys must be also knowing that remembering these times, bleeding time, clotting time, platelet time, prothrombin time, I'm sorry, and then thrombin time, and activated partial thromboplastin time, BTCT, right, alphabetically, right, these are arranged alphabetically, right? So BT is of 2 to 9 minutes, normal bleeding time, then C comes after B, right? So alphabetically this is 9 to 15. So BT, CT are in minutes. BT is of 2 to 9, then CT is of 9 to 15. Then again prothrombin time, thrombin time, and this is the biggest letter. Prothrombin time alphabetically comes first, 10 to 15, and thrombin time 15 to 20. APTT, the biggest, is of 30 to 40. So by these mnemonics, I hope you guys must be able to understand how to memorize, right, these typical disorders related to bleeding. And then finally this chart will help you to memorize the times. So guys, in comment section do tell me what is normal fibrinogen level, right, and what is normal level of factor A that will be required in diagnosis of hemophilia. So guys around me are now in fun mode, so we'll have one more performance, right? All the best guys, see you in next video. Bye, take care. Bye guys.
साए जहां तेरे मेरे रास्ते हैं, जादुई इमारतें हैं, मैं भी हूँ तू भी है यहाँ। खोई गई सड़कों पे सितारों की पलकों पे, हम नाचे उड़ते यहाँ। खो गए हम कहाँ रंगों साए जहां, खो गए हम कहाँ रंगों साए जहां।